I feel like I need more than a day, but is a day long enough to overhaul the entire NDIS? Maybe if we could see what happens, but I don't know. I think I would love for there to be funding allocated to support ability, especially in this space, especially in this such negative realm of disability and difference, and parents often having to paint the most dark, dire picture in order to get some funding. Like, I wish that we could fund the things that a child loves and the things that a child is good at. And I really would love if there was room in the budget for more respite for families and free counselling and really decent, good grief counselling and relationship counselling, and a real focus and overhaul on the language we're using around forms and documents and measurements that really can take the humanity away from a person with this medicalized language.
There is so much I would get done in that day. You've got no idea. I would just, honestly, 24 hours of that day, give it to me, and I would just clear out all the bureaucracy, because that is just becoming, there is so much between the patient and the health carers now that it's becoming life-threatening and dragged down into bureaucracy, and it's becoming nonsensical. So I'd go through, clear all that out, and so there is nothing that healthcare workers, doctors can hide behind the skirts of bureaucracy, that everything is transparent and communication is improved and streamlined, because it's only bureaucracy which is slowing everything down and causing so much pain. That would be cleared right out.
If I was Health Minister for a day, I would like to increase funding to palliative care so that people have access to the services earlier. It's such an amazing service that provides so many amazing things, and I think if people can access palliative care early into their treatment or into their diagnosis, they can understand what their options are. Whereas most people will only be introduced to palliative care during their end of life treatment, and not be given the opportunity to express their wants and needs during their treatment or anything like that.
I would make sure that everybody knew what supports are available in hospitals. I would make sure that doctors are reminded that not to get complacent. Not every child is a textbook. I'd fight for the funding that the hospitals and the families need to run more services like Bear Cottage. It's endless. That nurses are listened to more. Because if our children can't get what they need unless a doctor has given it the okay. And nurses are right there every single day, and they need to be listened to more.
I think if I was Health Minister for a day, I would have to polish off the federal component of that and call all of the states in Australia together and work incredibly hard to understand how to remove all the barriers within the states, try and unpick the funding issues for palliative care between state and federal, which is not just responsibilities, it's systemic, it's the databases, it's everything in terms of how do we all connect, so that we could land on a plan that meant wherever you were in Australia, whichever city, if you're in a regional area or a metropolitan area, everyone had equal access to the best in palliative care for their children.